Welcome to Insight Radio, powered by Vision Science Academy.
From London with Sucheta Mitra.
Welcome back to another episode of Insight Radio, where we envision future of vision science one voice at a time. We bring you inspiring stories and insightful conversations with industry experts who are making a difference in the world. I'm your host, Sucheta Mitra, doctoral researcher at Cardiff Met University and Education Engagement Manager at Vision Science Academy. Today we have a remarkable guest with us, Miss Junu Srestha, who is a graduate of London School of Hygiene and Tropical Medicine and the London School of Economics and Political Sciences in the subject MSc in Health Policy Planning and Financing. She is a recipient of a prestigious UK government scholarship, the Chevening Scholarship. She is a gold medalist in Masters in Public Health and Bachelors of Optometry from Tribhuvan University Institute of Medicine, Nepal. She was awarded the IAPB Eye-Health Hero in 2020. Currently, she is working as a Policy and Advocacy Manager at the International Agency for the Prevention of Blindness. Her major roles at IAPB include leading the development and delivery of the integrated people-centered eye care program, working closely with WHO and IAPB members to facilitate the implementation of IPEC in countries, producing advocacy support materials and policy briefs, and liaising with WHO to advance the issues of vision and eye health. Junu is also active in advocacy of national eye health related policies as an executive member of the Nepalese Association of Optometrists. Welcome, Ms. Junu.
Thank you so much, Sucheta, for such a comprehensive introduction of mine. I really feel very pleased to be invited in your Insight Radio. Thank you.
Thank you so much, Ms. Junu. So let's kick things off with your journey into eye health advocacy. Could you share the moment or experience that ignited your passion for advocating eye health, especially as a graduate optometrist back in 2016?
Thank you so much, Sucheta, for the question. So my advocacy journey, as if it started when I was studying optometry at the Institute of Medicine in around 2013 or 14 around. At that time, I was the president of Nepalese Optometry Student Society. And so we got to know about some of the lack of eye health recognition, lack of recognition of the eye care professionals, including optometrists in the country. So we used to take the opportunities of small programs like Farewell and Welcome program of the students to invite the policymakers of the country from Ministry of Health to talk about the policies in eye health and what could be the future prospect after graduating optometry. So those were the very first step of advocacy that I did. And after graduating, so I was also active in Nepalese Association of Optometrists, and then I joined Nepalese Association of Optometrists as a treasurer. So I got an opportunity to participate in the national workshop on development of the health policy, the National Health Policy Development Workshop. And in that National Health Policy Development Workshop, there was different group of stakeholders who were like divided into different groups to discuss on the different topics of the policy as if. And so we talked about including eye health into the basic health, the essential health services of the country. And so that was accepted. That was But our another concern also was the recognition of the eye care professionals, including optometrists, and integration of these profession into the healthcare system of the country. And so literally I raised some of the question with the policymakers at that time, too young, too more energetic to just like raise up the hand and then ask the question in front of all the big stakeholders, policymakers, asking the question about, so optometry started like 20 years ago in Nepal, but still there's no recognition. More than 80% of the graduate, they go out of the country for the education because they don't have opportunity in the country. So what is the prospect for us? How is the national health policy going to address all this? So now when I recall back those days, I feel very, a bit immature kind of, and then putting out our problems in front of all these stakeholders in such a national level program. So coming up from all the steps of inviting the policymakers in small college programs to like attending to the national level program and then putting out the questions, and then to moving ahead to organizing a national level campaign together with the Nepal Association of Optometrists, which is the Vision Screening March month. So there's all how my national advocacy in eye health it came up.
Thank you, Ms. Junu, for sharing your incredible personal experience, which somehow shaped your career path. Your journey is truly inspiring. So, let's move ahead. Your role at the International Agency for the Prevention of Blindness is quite intriguing. Can you give our listeners a glimpse into your day-to-day responsibilities as a Policy and Advocacy Manager?
Yeah. I joined IAPB, International Agency for the Prevention of Blindness, which is an overarching alliance for the global eye health sector in the world. It's the only organization that is in official relationship with the World Health Organization and does the very close advocacy to WHO and other international organizations like UN. I started my career there, or my job there, as a Policy and Advocacy Manager in 2021 September. So I just have 2 years of experience now there. But talking about my day-to-day job and so what I have been doing there is so I'm assigned about leading and supporting members. So IAPB has 200 plus members all over the world. The members include NGOs, eye care service providers, pharmaceutical companies, universities, academic institutions, and a lot more. So supporting them for advocacy, especially advocating for the integrated people-centered eye care. So for which I've been leading to produce some of the support documents, advocacy documents, along with my team and along with the advocacy core group. So there's a core group of people who are involved in eye health advocacy. So there's that group of people with whom we are involved in producing such materials. For example, last year we prepared Advocacy to Action Integrated People-Centered Eye Care. That's basically a toolkit supporting everyone who is involved in advocacy of eye health. That's the toolkit supports them to advocate the government policymakers on what actually the integrated people-centered eye care is, what's their importance, and so how can they move ahead and support the government to implement the integrated people-centered eye care in the countries. And so other work include, I closely liaise with the World Health Organization for the advocacy activities and also to raise the issues of eye health with the WHO, within the WHO in their activities. Also, I work with the experts in eye health to produce the policy brief. Some of the policy brief that we worked on is the integrated people-centered eye care and also on the diabetic retinopathy, which is coming up very soon. So I also conduct some of the online sessions called, there's an Advocacy to Action program at IAPB, so which includes support materials plus online events, webinars, and they are basically aimed to inspire, to support the advocates in eye health all over the country, all over the world, to help them, make them able to equip them with knowledge and skills for advocacy. So this year also I am leading organizing those events in different regions like the Southeast Asia, Western Pacific, Africa, Latin America. So we are also doing the repeated session of those. So these are all my works which I do at IAPB.
Amazing. So as you have said that you have been involved in the development and delivery of integrated people-centered eye care program. So could you explain what it is and why is it important, and how we as an optometrist at any level can play a role in advocating for its implementations in different countries?
Yeah, so integrated people-centered eye care is a very important topic which not every eye care professional, but every health professional need to know and understand what is this about. So actually this came as a resolution, the World Health Assembly resolution in 2020. The World Health Assembly resolution is an event where all the World Health Organization member countries, that is 192 plus member countries of the world, they come together and they decide the the policies, the global policies. So what's going on in the world? So what is the rising agenda? So for tackling those health issues, they come together to bring those global policies. So integrated people-centered eye care, that also came as that global policy in 2020, integrated people-centered eye care, including preventable vision impairment and blindness. So that was the resolution which was committed by all the member states at the World Health Assembly. So what exactly this terms means? So as the term suggests, integrated people-centered eye care. Integrated, it means that the eye health in most of the countries, so we might think about our country where the eye health is like they work in silo, they don't have much of the share from the government, but it's not only in our countries, but it's in everywhere, in most of the part of the world. The eye health is like they work in silo, they have very little or a very negligible kind of ownership from the government. So the integrated people-centered eye care basically focuses on the eye health should be integrated into the basic health system of the country, so that it runs together with those, so that people can have the services along with the other primary healthcare services that they receive from the health service. And then people-centered care, it means that so the services need to be people-centered, which means that the services that the clinicians provide, that the ophthalmologists, optometrists, or any eye health professionals they provide, the services should value the people's preferences. So for example, when you're providing or when you're offering a cataract surgery to a patient, you need to explain also about, okay, these are the different impacts and these are the outcomes coming up. So there are the different types of surgery you can get. So which is the one that fits you? So it's about not you treating the patient on your need, but it's about treating the patient on the patient's need. Basically, so it's going in line with what exactly the patient wants. The treatment protocol fits with the patient, because we know that every patient is a different individual. The physiology is different. They're like the treatment or the mode of healing, it differs with the patient. So integrated, it means integrate with the system, integrate with the 6 building blocks of the health system. That is integrate at the policy level, integrate at the human resource level, integration at the information level, the medicine, supply of medicines, integration at the financing, communication, and everything. And then people-centered means we value the patient, treat them as if you are treating a patient with an opinion. So always value their opinion, their judgment, and think about their background also when you are treating the patient. If you don't mind, then I just want to share an example of my own experience. So while I was working as an optometrist in Rayukai Eye Hospital, which is an eye hospital in the periphery of the Kathmandu in Nepal, so there was two girls. So both of them amblyopic, both of them similar power. I think they were unilateral amblyopic, lazy eye in one eye, while the another eye was completely normal, 6/6 vision. And then I called them both for the vision therapy. So one of the the girl, she used to come every twice in a week, and her vision was also improving in coming 2-3 months. But then another girl, to whom I also prescribed the similar kind of vision therapy, she couldn't come. She just didn't follow up in 3 months, and then came up with her broken glasses. So I thought that, and then I realized that it's not the treatment that you provide the patient give the outcome that you want, but there should be equal involvement from the patient side as well. So the child who couldn't come for the treatment for the vision therapy, she used to live very far away. There wasn't the accessible public transportation to reach the hospital, and she had to walk 1 hour to reach the hospital. So there's no way you can call that child to leave the school and then come to the vision therapy twice a week to the hospital. So then I realized that it's not only it's not the treatment that you prescribe, but it's the background, it's the surrounding of the patient or the service receiver that also matters for making your treatment to be successful. So this is what the people-centered eye care exactly means in a lay term.
Okay, that's really intriguing, and that's sounds like a comprehensive approach to eye care. So I'm sure that our listeners are eager to learn more about how they can contribute in such impactful programs.
Yeah, great. And so you're also saying about how optometrists can act for the central people-centered eye care from their level. So we as an optometrist, we are involved clinically, we are involved academically, and also we are involved in public health policy making. So it's a kind of diverse profession where people can be involved in business, administration, academia, everywhere. So as an optometrist, wherever you are, whatever service you are into, we have to think about providing a people-centered care, so valuing their preferences, valuing their needs, the patient's need. And also if you are a very new graduate, or if you are curious about what exactly this is, there are a lot of support materials on knowing about integrated people-centered eye care available at WHO and also at the IAPB site, which you can read and go through them. And also please, I would suggest you develop that capacity to advocate, to reach out to the local government, or to reach out to your administration to talk about the integrated people-centered eye care. So the first step of advocacy is about reaching out to people, speaking about this one. So please be you understand yourself, and then talk about the integrated people-centered eye care with people around you, and then develop some capacity to advocate to the policymaker or government stakeholders or local stakeholders wherever it's possible.
Yes, that's true. And advocacy sometimes comes with many challenges, I would say. So can you share some of the challenges you have encountered in advocating for IPEC, and how have you overcome those in your work?
Absolutely, yeah. There are a lot of challenges. So previously, from my very immature kind of experience, people might also go through some of them when doing a very early advocacy time. That you might be speaking about the problems only. So it's not only about problem that you tell to the stakeholders or the policymakers, you also tell them about the solutions, like what could be the cost-effective solution, or how can they approach ahead to the problem that you have mentioned to them. So this is one of my tips to them. So my challenges after I started advocating for integrated people-centered eye care, I felt was, so again, eye health isn't much a priority issue in most of the countries. So the thing is, the policymakers, the government stakeholders, although they listen to you, the ultimate thing that goes into is the finance, and then the priority, the resources that's available in the country to implement those. So unless and until there's a very strong supporting hand, resources for implementing such good principal program in the country, it won't be possible. So I feel like, and the challenge that if you ask me how do I overcome those, then the first point I tell them about is the government, they have committed to the integrated people-centered eye care. So it's the issue that it was raised by the countries only at the World Health Assembly. So it's raised by them, and they have also committed to implement those in the countries. So it's like we have to remind the policymakers about this, and then besides taking the challenges aside, so keep on advocating for acting like one step at a time. Like you can't achieve everything at the same time because of the finance resource issues, but you can do one at a time. So that I would say to solve those challenges.
Yes, that's true. And if we talk about optometrist role, both new graduates or experienced professional do to actively support the implementation of IPEC in their respective countries.
Yeah, as I said earlier, so I think like the new optometrists, they can first of all learn about what integrated people-centered eye care is and explore about the resources of those that are available at the WHO website and also at the IAPB International Agency for Prevention of Blindness website as well. So before you go and speak about this to others, it's very important that you learn and know about this, the principles of this, and the different steps of implementation. So there's the 4 phases of implementation which WHO suggests. First, you have to do the analyze, that's conducting the eye care situation assessment. called XAT, and then planning, which steps include the strategic plan, making the strategic eye health plan in the country, and then operationalizing those plans and then reviewing. So the 4 phases of integrated people-centered eye care. So it's very important to learn first about the IPIC by the new graduates, and also by the experienced one if they don't know about this. And so I would say, like, it's very important, as if you know about the integrated people-centered eye care, or if you come through about this, and also important to follow the principles of the integrated people-centered eye care in your day-to-day practice as well. So follow those people-centered care, which is also helpful to you and also the service receivers as well. Because from a service receiver perspective, they'll feel that they are being valued, they are being some space in their treatment. This is the perception of the service receiver. And from your side also, so you are providing the treatment which fits the patient, and it's for sure that you are getting more compliance and more better outcome when you take in consideration of the patient's choices. So that's basically for the newcomers. And for the experienced one, I would say that once you know about the integrated people-centered eye care, I said that integrated also means integration into the different building blocks. This is the building blocks of the health system. So please go and approach with the policymakers, and also through the optometry associations or optometry society that you are involved in, advocate for some policy change in the country, advocate for this implementation of the IPIC, and also teach or make the newcomers learn about what exactly this is, and also involve the newcomers also in advocacy, and make your presence in those policy dialogues and policy talks going on in eye health in your country.
Yeah, and as you have mentioned, you are also advocated the guide for beginners you recently produced. So what are key advocacy messages you would like to highlight for our listeners?
So we recently produced an advocacy guide for eye health beginners. So this is basically about anyone who is interested in doing advocacy for eye health without any knowledge, just the beginners, but are interested, very passionate about doing advocacy. So the guide is for them. So the few tips that I would like to give you, the advocacy tips, is first of all, make it simple. You have to make your advocacy simple. So whenever you are approaching to the policymaker, local governments, and everyone, they won't be able to understand your jargons, the clinical jargons. So make the language very simple. And make it also the short. So the messaging should be short and simple. They should be brief. So you know that the policymakers are very busy persons, so they won't have time to read through long articles or long letters that you provide them. So be brief, just give some points to them about what your problem is and how the solution can be reached together. So don't just put a pressure on them about the problem. So also think about the solution. So what the solution could be and what could be done together. And also I would say work together, be inclusive, because this isn't what we are going to achieve it alone. So there are different eye care professionals, also eye care service providers, other different stakeholders as well, who are direct or indirectly very much linked with the eye care service of the country. For example, the Ministry of Education, the schools, the NGO sector, the private sector, business companies, academia, everyone. So who are involved or who are impacted by the policy change that you are advocating for, also please involve them in your advocacy. And also another thing is, this is for not only for the optometrists but for everyone. While you are doing the advocacy in the country, it's very important that you know about the different policy cycle of the country, because policy can only be changed when there is a good policy window. There is a certain cycle of the policy which runs throughout the year, or through the fiscal year, so learning about those policy cycle also help you, what time would it be better to hit into the policy for the change that you want. So these are the few tips that I want to give to you. And for more, I would request you to please visit the Advocacy for Eye Health Beginners Guide at IAPB's website.
Thank you so much for sharing these key messages to our listeners. And let's move ahead. So, what are some effective interventions and cost-effective approaches to addressing conditions like cataract, glaucoma, diabetic retinopathy through advocacy?
Yeah, thank you, Sucheta. So one of the aspect of the health that we have been, most of the system or most of the people have been missing out is the prevention and promotion, and that actually comes out to be the most cost-effective interventions, the prevention and promotion. So I would say for the conditions that you have just highlighted now, the glaucoma, cataract, and retinopathy, the screening would be the most cost-effective intervention. And also, if you say about advocacy, then please, advocate for screening of these conditions. And for screening of these conditions, advocate about integration of this screening of these conditions into the basic health service of the country. So the primary healthcare centers, which are nearer to the people, so the people have tendency to go to the nearest healthcare center that's within their reach. So advocate about at least having screening of these conditions into those primary healthcare services, the primary health centers, and if possible, also advocate about making this treatment available there, and if not, then making the referral process smooth from those primary centers to the secondary or the tertiary level. So for this, you might need to advocate about the integration of the ophthalmic personals or the eye care professionals in those primary level as well. So it involves not only the intervention in the health service, but also other surroundings that support in creating those favorable environment. That's the human resource, that's the necessary medicines, necessary supplies that you need, and also integrating that into the health system, the information system of the country, so that it later goes into the planning process, into the central planning process when it's integrated into the information system of the country. And also, I would suggest that to advocate about inclusion of the eye care services financed through the government health financing system. For example, there are a lot of different health insurance schemes in the country. Many countries, they have their own national health insurance. So if the eye health services are financed through the national health insurance system, then people will have more access to them, because if you say like the distance and the finance, those two are the mostly recorded barrier to access these services. So if those problems are solved, then definitely I would say this would be the most effective intervention for the conditions that you said.
Amazing. Thank you so much for sharing this. And let's move ahead towards Insight 2030. So could you share with us the strategic plan behind Insight 2030 and the impact you envision it having on eye health advocacy?
Wonderful. Yeah. So 2030 Insight is a sector strategy for eye health. So before that, everybody knows the Vision 2020, the Right to Sight, which was started in 1999 and that ended in 2020. So there was going to be a sort of gap in what in the eye health sector strategy, what's coming up next. So IAPB and the eye health stakeholders, they came together to produce a sector strategy, which is called 2030 Insight, and that is the strategy for this decade until 2030. So this strategy, it basically focuses on three different pillars, which is elevate, integrate, and activate. So elevate, it's basically about elevating eye health, issues of eye health, not only within health, but beyond health, because eye health is linked with other issues, other social and development issues as well. For example, children within refractive error but no access to spectacles will have the impact in education, will have some impact in going to schools. Likewise, a skilled worker having some errors in eyes or any eye health issues will have some effect in their economic productivity. So eye health is not only linked with the health issues as only, it's linked with other social and development sectors most. So other social the Sustainable Development Goals, SDGs. So there's a report called the Lancet Global Health Commission on Global Eye Health, which is so that eye health is linked with more than half of the Sustainable Development Goals. And so regarding this fact that eye health helps in achieving those Sustainable Development Goals, the UN, the United Nations, at the General Assembly in 2021, they had done a resolution called Vision for Everyone, accelerating actions for achieving Sustainable Development Goals. So considering the fact that eye health is linked with a lot of the social and development issues, so they have the countries, again, at the United Nations General Assembly, they came together to do a commitment on accelerating the services, accelerating the actions for eye health. So the 11th issue is about that. And then integrate. So integrate, we are talking about the integrated people-centered eye care. So it's basically about that, integrating eye health within the health system. So again, as said earlier, most of the countries, the eye health is in silo. They are unprioritized much in the government. So it's very important that eye health needs to be recognized first by the health sector. It needs to be integrated into the health system of the country, and then only we could progress to the 11th pillar. So integrate is about integrating eye health into the health sector. And finally, the activate. Activate is about, so there should be some demand from the people as well, from the customers, or from the service receivers as well. So they need to be aware about their own eye health. So when you are providing the services, people also need to be aware about what I am getting the service, if I'm getting the right service or not. So how are my eyes or my ocular health being treated? So it's about the service receivers, so activating them or making them aware to generate a demand on eye health, because we know that almost more than like 1.1 billion people in the world, they have some treatable kind of avoidable kind of blindness and vision impairment. So if these people, they get aware about this and they know about how eye health can link with their other issues, other social and development issues that are linked up with their eye health, they can come to assess the services. So activate pillar is basically about the people. So these three pillars, they are incorporated into 2030 Insight. And so in this decade, this is also very much directed the eye health advocacy in this decade, that advocating eye health in the traditional health system or traditional health limitation is not enough. So go beyond health, go and advocate to the education, go and educate to the labor sector, go and educate and advocate to the finance and other like road safety, school eye health, and all of these.
That's amazing. And if we talk about Insight 2030, what are our goals to achieve at the end of 2030? What are we visioning?
So the 2030 Insight, it visions about no one in the world should experience the avoidable kind of blindness and vision impairment, and everyone should have the potential to overcome their blindness and vision impairment and reach the maximum potential. So even if people, they have blindness and vision impairment, through rehabilitation or through other approaches, their potential can be restored. And if anyone has avoidable condition, by 2030 it envisions that no one should be suffering from those conditions.
Yes, that's true. And let's shift our gears a bit. So you are a Chevening Scholar, a remarkable achievement for you. Can you share your journey and how you learned about the Chevening Scholarship opportunity?
Yeah, of course. So Chevening, I was a Chevening Scholar. I studied the MSc in Health Policy, Planning and Financing at London School of Hygiene and Tropical Medicine and London School of Economics and Political Sciences. It's a joint course between two schools under the University of London. So it was under the Chevening Scholarship. So this was in 2020. I got to know about the Chevening Scholarship just a year before that, in 2019. So the application process and everything starts a year before the actual enrollment in the university. So Chevening, it basically sees some leaders, some person who can come back and can have some social, some national impact in the country, some learning that they receive in the UK, they can come back to the country and use them to develop their society and develop the country. That's basically the Chevening's aim, and the ethos is behind Chevening is that. So talking about my journey, after I studied bachelor in optometry, I was working just as an optometrist in an eye hospital and also in a clinic. Then I was very much intrigued by the story which I told you about the two girls who had amblyopia. And I thought about, it's not only the treatment that you are giving, but it's about the background issues, it's about the surrounding that affects the outcome that you are giving. So I suddenly came to my mind that I think I need to study some public health. I need to learn more about what's going on behind the treatment that you give. It's not the spectacles, not the medicines, not the eye drops you provide, but it's other issues. So I wanted to study more about those. So I studied Masters in Public Health in Nepal. And while I was studying Masters in Public Health, basically two things strike me. One thing is, if you want to change like one person's life, then you just give medicines. If you want to change like hundreds or more people's life, then you have to change policy. And so health policy was the one which I was intrigued a lot. So you can change like more people's life, hundreds of people's life, by just changing a health system or a health policy of the country. Another thing is so you know that for any decision making, finance comes ahead, economics comes ahead. So I was much interested in this economics and policy. So with those my interests, I was doing some of the research as a research coordinator in some local NGOs in Nepal, which was related in maternal child health. And also with the start of the COVID, I started some of the research of the COVID as well. But I was very much, interested in studying policy and economics. I was feeling the lack of knowledge in policy and economics, and I was thinking that I'm not being able to make real impact that I was starting to think when I studied Masters in Public Health. So that actually inspired me to apply and go for Chevening Scholarship, which I just came through randomly in some Facebook status of some of my known people who were awarded the Chevening Scholarship. And I went through and searched about what this is about. And so the application starts around August, and it ends in November. So I got those September, November, 3 months of time to write all those applications and go through this process. I applied those. I was selected in an interview, and then finally I got the scholarship and was able to study in London.
That's amazing. Thank you for sharing your journey. It's a true testament to the opportunities that can open up through a scholarship like Chevening. So how did you, if we ask about your whole journey, how did you go about choosing your course of study in the UK, and are there any specific programs or courses that are tailored for optometrists or eye health professionals?
So as I said that I was interested in policy and economics, so I went I searched a lot of universities, a lot of government universities in UK to study this. So being a public health professional, everybody very much yearns to go to the LSHTM, London School of Hygiene and Tropical Medicine. I was searching for some course there, and then I found out about this one, the MSc in Health Policy Planning and Financing. It was a bit different heading than what I had thought about. So I was thinking about health policy and health economics. And I found out that this was a joint course between LSE also. So LSE is one of the recognized university for economics, for some social and development studies. So I liked that this course is going to be a joint course. So I went and I approached for this course. For your next question about is there any specialized course for optometrists and our eye care professionals? So there is just one which I know is the MSc Public Health in Eye Care, which is taught at the London School of Hygiene and Tropical Medicine. Is a 1-year master's degree course which basically designed for the eye care professionals. So that is one which I know is the specialized course for the eye care professionals. But besides that, I think optometrists can go and reach out for any other subjects that they want, like policy, development, genders, and any other issues which they can see around. yeah, that's it.
Okay, so could you describe the application process for this scholarship and any specific components that candidates should pay close attention to?
Yeah, of course. So as I said, this starts sometime in August, and the application process of the Chevening, every year it's open. So the application process, it takes almost a year from its starting of application to the end of the end means that's being successful in the application. So it starts sometime around in August, so in all of the countries. So I'm not actually aware about how many countries, but I think it's in more than 115 countries of the world where the UK government provides scholarship to the students for masters to study masters in UK. So it starts in August, and the closer would be the first week of November, the closer of the application. So after that, the candidates, they go for selection for the interview, which takes place sometime around April of next year, April. And after that, towards June, they receive the success or the unsuccessful of the application in June. But that doesn't complete the application, because you have to get the offer letter also from the university that you want to go. So there's a time frame that you can bring up that offer letter to the Chevening Secretariat, and then with that they process the final offer of the scholarship in July, and then it starts with the application for the visa for coming to the UK, and then the study actually starts in September. So it's like from 1 year of August to next year of August is the whole of the process of the application of Chevening. And coming to your next question of what exactly or what could be the different areas where the Chevening scholarship looks at the student. So there are basically four major areas where the student or this candidate need to excel on are the leadership, networking, career, and then future plans. So these are the four topics which Chevening asks you to write an essay about. So showing about your leadership skills and how are you going to demonstrate that when you come back in your old days, or how have you demonstrated leadership skill? How are you going to use your networking, or how are you going to you'll get such a big opportunity in UK to meet people from so many different countries, different cultures, different level of people working in different areas. So how are you going to bring that networking back into work to achieve your objective in the country? Networking, and then your career. So why are you going to choose that study in UK? So how is this going to help you to achieve your career goals? And what exactly is the gap that you want to fulfill through this academic or the master's degree through Chevening? So this one, and then what are your future plans? So after coming back to the country, what are you going to give back to the society as a whole? So it's about being a bit more larger perspective than just you studying the master's. It's about giving something back to the country, back to the society as well. So those different four areas are the one which the candidate need to prepare about for Chevening.
Yes, just amazing. And what advice would you like to give our optometrists out there who aspire to become a Chevening scholar or who wants to experience studying in the UK? So how this process should look like, and what are the points they should concentrate on?
So yeah, as I said earlier, for the optometrists who aspire to the Chevening scholarship, I would say think a bit from a larger perspective. As I said, for myself also, I was thinking it from an eye health, from a perspective of a larger perspective of the society, not into the health only, and how it's going to impact the life of the people, the financing of the people, the expenditure the people are doing for achieving the outcome in eye health. So please, think from a larger perspective. Think what you can give back through your study, and how, and also, like, if you, while you are doing some research, find out what is the gap that you want to fulfill with the study. So first of all, like, find out what you want to achieve in future, and then for that, what's the gap? Find out that gap, and to fulfill that gap, find out which study is going to fulfill that gap. So find out the gap, the study, the course, and also based on that, you have your future plans, you have your degree, you have your bachelor's or the earlier master's degree. So to join that, or to breeze that gap, find out the study. And also, I again, always think about a bit of larger perspective, giving back more to the society. So this is not a saying, but a very much wide belief that so the more you educate people, the more you are going to learn those. So think about that, and like try to give more back to the country, more back to the society. So some of the tips while studying in UK, I would say, is, as I said earlier, there is a large number of people from all over the world. You are going to get a diverse background of people while you are studying in UK. So I would say, like, please, reach out to everybody, make friends with them, and also do some networking. Also, like, don't be shy or don't be afraid to share about your culture to them, and also to learn from their culture. So from my own experience, I would say, so while I was studying there at LSE during one of the workshop session, so I was a bit reluctant to give my answers. I was thinking that, if I might say this answer, I might sound stupid, or I might sound not relevant to the UK, because I might be talking about my own country. Then, like, I could just express this in my small groups, but not in front of the lecturer. And then the point that I was sharing to my group, it eventually came out to be one of the important points that the lecturer wanted to discuss. So please, be confident on the education. Please be confident on what you know, and then don't be shy to express those. Make friends, to like networking, travel a lot in UK, know a lot about the history of UK, the culture of UK. So it will it will try to make your studying at UK more valuable, more filled with memories. And also, especially for optometrists, I would also suggest them that you might want to explore how the eye health system works in the UK, the health system and the eye care professionals there.
Thank you so much, Ms. Junu, for sharing your insights and incredible journey with us.
Thank you so much, Sucheta.
It's been an enlightening conversation, and to our listeners, thank you for tuning in to Insight Radio. Keep yourself motivated, up to date, and committed to the changing the world for the better. Until next time, see you. Thank you for watching. If you found this episode valuable, be sure to subscribe to our podcast on your favorite platform. Never miss an episode.
Insight Radio. One vision, many voices.